I'm medical Dr. Adelia, and I'm here today to discuss the conventional treatment options for anxiety disorders. Anxiety disorders are the most common psychiatric disorders in North America, with social anxiety disorder being the most prevalent among them. Of the major anxiety disorders included in the Diagnostic and Statistical Manual of Mental Disorders, there are generalized anxiety disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and social anxiety disorder. The pathophysiology of anxiety disorders is multifactorial. Oftentimes, anxiety issues may not be due to a primary anxiety disorder and are due to a medical condition, hypoglycemia, cerebral allergies, or psychosocial stressors. Anxiety disorders may also be due to genetic factors and autonomic nervous system dysregulation, neurotransmitter dysregulation, and learned behavioral responses. The treatment of all anxiety disorders varies somewhat, where conventional methods for generalized anxiety disorder include CBT, SSRI medication, and benzodiazepines. The recommended doses for commonly used SSRI medications are citalopram 20 to 40 milligrams daily, escitalopram 10 to 20 milligrams daily, fluoxetine 20 to 60 milligrams daily, duloxetine 30 to 120 milligrams daily, sertraline 25 to 50 milligrams daily, paroxetine 20 to 50 milligrams daily. The general recommendation is to limit the long-term use of benzodiazepines due to their lack of efficacy for long-term use and the high risk of dependence and potential cognitive effects. SSRIs tend to have less risk for dependence associated with them, but common adverse effects include a worsening of anxiety, nausea, insomnia, agitation, anorexia, somnolence, sweating, dry mouth, dizziness, headache, diarrhea, constipation, and sexual dysfunction. Obsessive compulsive disorder can be quite treatment resistant, but higher doses of SSRIs and a reduction in the patient's overall anxiety levels have been shown to improve symptoms. Behavioral therapy is first choice, and CBT is often used as well. Panic disorder may be treated with SSRIs and CBT along with exposure therapy. Benzodiazepines may be used acutely or preventatively on a regular basis. Social anxiety disorder is typically treated with SSRIs and CBT. Post-traumatic stress disorder is treated with SSRIs as a first-line agent, alpha-adrenergic blockers which may alleviate sleep disturbance caused by nightmares, and EMDR, eye movement desensitization and reprocessing, is an emerging therapy being shown to help PTSD patients.
Hi, I'm naturopathic Dr. AJ. From a holistic approach, we need to consider a patient as more than just physical symptoms, but symptoms that may not always seem present. Mental health. Many times patients will approach naturopaths seeking help for physical signs and symptoms when, if investigated further, may be coming from a psychological imbalance. First, we must address the patient's diet and lifestyle and determine if they appear acceptable before moving on to mental health. Key factors such as hypoglycemia, cerebral allergies, deficiencies in magnesium, B12, and amino acids should be ruled out. If anxiety is present, other comorbidities must be ruled out, with the most important being depression, in order to encompass a full image of the patient's health. Other comorbidities that should be screened for include personality disorders, substance abuse, migraine, IBS, and chronic pain. Risk factors that should be considered in diagnosing anxiety include family history, past history of anxiety, a stressful life event, comorbid psychiatric disorders, especially depression, and being female. There are a variety of treatment options from a naturopathic perspective, so many, in fact, that I decided to narrow down the top 5 that, after reviewing the literature, appear to have the most research in their favor for treating anxiety. Top considerations for naturopathic treatment of anxiety should include inositol, fish oil, L-theanine, magnesium, and vitamin C. Inositol was shown to use an alternate mechanism of action from SSRIs in CT scanning to reduce number of panic attacks when compared to fluvoxamine and significantly reduced scores on YBCO scales. Dose recommended is 18 grams per day. Fish oil was shown to decrease anxiety in medical students by 20%, and a meta-analysis determined positive effects of its use in the treatment of anxiety. Dose recommended is 2.5 grams per day. L-theanine has been studied with positive effects in relation to the stress response and blood pressure changes associated with it. Dosing is considered at 400 milligrams per day. Magnesium in clinical trial reduced HAMD and HAMA scales in patients experiencing anxiety. However, most clinical trials used combination supplements with zinc, calcium, B6, and an herb related to the opium poppy. Thus, more research with magnesium as a monotherapy is required. Typical dosing is 5 milligrams per kilogram of body weight. Vitamin C has been shown to reduce anxiety levels and academic performance. However, no significant changes to stress and depression were observed. Dosing is recommended at 500 to 1,000 milligrams per day. Other treatment options that are available and should not be overlooked include phosphatidylcholine, N-acetylcysteine, S-adenosylmethionine, L-arginine, L-lysine, and L-tryptophan.